A model of the eye, and here you can see some muscles on the top here. That'll be, if this is the top, that'll be the superior rectus. The bottom one, that'll be the inferior rectus. So this will be the lateral rectus, and over here, that'll be one of the oblique muscles. I'm concentrating on the inside of the eye. So we call there are three layers for the eye. They're called the tunics. So you have a white layer, which is called the cornea, and the middle layer, which is pink in color, that is the vascular layer, and the pink layer, the yellow layer is the neural layer. So you have the fibrous layer, you have the vascular layer, and you have the neural layer. On the inside, this part here, you can see the optic nerve exiting, and this part here where the optic nerve is exiting, it's called the optic disc. There are no receptors, light receptors here, so it's a blind spot. Over here, you can see a little depression here. This is called the macula. You might have heard about macular degeneration. So that's a condition where this area deteriorates. This is where there's the highest concentration of the receptors. The receptors are called rods and cones. Rods are for dim light, and cones are for bright light. And also here you can see as we move forward, the middle layer, which is the pink layer, that becomes the
lens bulb.
So over here you can see the lens. That's the lens. I took off the lens, and this little hole here, through which the light enters, this is called the pupil.
Pupil.
Okay, so that's the pupil, and surrounding the pupil, you have the ciliary body, which contains some muscles. So these are the muscles which contract and makes the pupil small and large. So you have muscles which are radially situated. They cause the pupils to enlarge. And there are circular muscles which cause the pupil to constrict. Over here, this is so you have the pupil, you have the ciliary muscles, you have the ciliary body, and the ciliary body ends with this part where it ends. This is called the ora serrata. Okay, so this is the ora serrata. Yeah.
What about the iris?
Iris, this is the iris. This part here is called the iris. And in the middle of the iris, you have this opening, that is the pupil. Okay. So this is the iris. This is the ciliary body. The iris contains all these muscles, which are going to cause the eye to dilate or constrict. So when you go to an optometrist, they dilate your eyes because they want to see the back of the eye. So what they are doing is they are giving some drops which causes these muscles to dilate. So these muscles will be acting. These are the muscles which are attached to the pupil. They will dilate. They will pull the pupil open so they can see the inside of the eye properly. So it's called, they dilate the pupil.